My name is Pablo Garcia. I'm in my first year of residency out of the Rural Hanover program with Western University, and I am a resident who is an IMG who graduated from medical school in Guatemala, Central America. My hometown currently is Hanover, Ontario. The reason why I selected rural medicine was because I had the opportunity to do some observerships in rural medicine in the past before applying for residency, and I was able to see how vast the learning and how vast the opportunities for different encounters and different sections of medicine I was able to obtain during my observerships. I saw also there was a huge opportunity to do more than just a clinic setting. I was able to see also how much opportunity there are in hospitalist medicine, in OB, in surgical assist, in doing small procedures, and doing also emergency room attending as well. So that is the reason why rural medicine, I think it's also a very vast field that many people are not aware of, and that I believe that everybody should know about and also should be interested in it. Currently, there are 3 residents that are selected every year in our program. In total, we have 6 residents in the program at any given year. One thing that I love the most is the work environment. And I say the work environment because there's a younger core of physicians who are attendings and that are also working in the clinic and hospital with you at all times. The importance of this is that you're going to be learning from people who have a lot of knowledge in the most up-to-date treatments and approaches to different pathologies and different medical presentations in medicine. I also want to highlight how important it is for anybody to consider the work environment wherever they go in their residency. It is very important because you have to consider that you're going to be at least 2 years in this one site. So you need to make sure that you know who are you working with, because you're going to be living with them for at least 2 years. I have to be honest with you, I love hospitalist. And in the Hanover rural program, we do hospitalist work every day from Monday to Friday with a patient or several patients that you are in charge of following up and treating while they're staying in the hospital. It is a vast opportunity for learning, and not just how to manage a patient, but also to do appropriate community care, to also to understand how the system works. And these are things that you have some exposure as a clinician, but as a hospitalist, and this becomes more complex. And this is why I love hospitalists. Also, the scope of medicine that you as a residency as a hospitalist is very wide, and there's also a lot of opportunities for learning. No, I don't. I wish I could. However, I have a baby coming soon, so my time is limited. But there's also opportunity to do advocacy work or research if you want to do it in a rural program. What is one thing that I like to do during my free time? Well, I love to go out for hikes. One of the greatest benefits of being in a rural site is that there's a lot of places where you can go out for a hike. And Hanover is located in southwestern Ontario, but one of the interesting things is that it is kind of close to many adventurous sites. You can go have a hike by Lake Huron, you can go do a hike at Collingwood or by the Blue Mountains, or you don't go that far. Hanover has a lot of conservation areas around our site that are very nice to go walk around, do some sightseeing, take out your dogs for a walk, or if you just want to go have a picnic around the park. That's very easy to do with any rural site. Well, one thing for sure is that I want to work here in Hanover. Again, considering the work environment, how well along you can get with your preceptors, with your attendings, and how wonderful the community is and supportive of rural physicians. Hanover is a place to go for sure. And I want to work here until I go old and I want to retire. Well, the most important thing that I can tell any medical student who is interested in rural medicine is to try to secure an elective in a rural site. It doesn't matter if it's in Hanover or in Northern Ontario. Just make sure that you have worked in this place for at least a rotation, so you can see the work environment, you can see who you're going to be working with. You will also have the opportunity to interact with other residents who are going to be very honest, and they will be telling you what is their impression of the site that you are or that you will be doing an elective in. It will also let you know how much learning you're going to be doing, how your schedule will be on a given day, and it will also let you know how many opportunities for learning you will have during this time. Thank you for having me in this initiative. I wish each one of you all the best in your future plans as medical students and residents. I know that each one of you will be wonderful physicians. All the best.